To Kebbi, where the state government says its draft policy on social protection will address issues of healthcare delivery, education, food and nutrition, child and maternal mortality, among other developmental issues. Chairperson of Technical Working Committee and a Permanent Secretary, Kebbi State Minister of Budget and Economic Planning, Aisha Mohammed, stated this during a two-day workshop to validate the draft policy document in Sokoto. The policy seeks to harmonize all social protection programs to have coordination in fighting poverty and minimizing all forms of inequalities suffered by the vulnerable and less privileged members of the society.
It's a document that takes care of welfare of the people, providing them with empowerment activities and also reducing their vulnerability. It's an inclusive document that is meant to improve the living standard of the people of Kebbi State.
Actively delivered to improve the quality of life and the standard of living of people in Kebbi State, particularly those who are downtrodden, this is one of the key focus of Oxfam, particularly in our work in Nigeria.
Different MDs that are implementing series of social protection programs aimed at reducing poverty and vulnerability were in place but unharmonized, uncoordinated. As a result of this technical working group, there is a platform where all the MDs are meeting on monthly and quarterly basis to discuss and identify and share progress on social protection programming in Kebbi State.
Ensure that funds are placed in areas that will bring up those in the very low strata to at least the average strata in our society.
This social protection, especially the poor and marginalized people in our society. And then, as you can see from the document, we are trying to see how government can provide kind of a package for age vulnerable children.
Who are the beneficiaries of this exercise. And we are glad we are here. We are glad we are part of the document being prepared.